Hi, everyone. Thank you for taking the time for stopping by today at the American Liver Foundation's Liver Health Poster Competition. My name is Suhail Sidhu, and I'm a third-year medical student at Creighton University School of Medicine, and I'm here with Walter Crum and Chirag Patel, two other medical students, as well as Dr. Rangray, an attending under the Department of Gastroenterology. Today we're going to be talking about a global approach to analyzing chronic liver disparities in incarcerated individuals. We already know that they're disproportionately impacted by viral hepatitis, which is something that we can reliably vaccinate against, screen for, and treat. However, one of the issues with viral hepatitis is that it has the potential to develop into cirrhosis, as well as other forms of chronic liver disease like hepatocellular carcinoma. We know that incarcerated individuals have a higher risk of hepatitis B and C, and it's most commonly spread through blood-to-blood contact. However, the problem is that when we take a more global approach, we realize that it's more difficult in other countries. For example, hepatitis B was found in 8% of prisoners in India, and hepatitis C was found in 7% of prisoners in India. What was interesting about that research was that they found that transmission between incarcerated individuals was low, indicating that these individuals already had the disease prior to them being incarcerated. Another study found that hepatitis C was as high as 9 times as the rate of the general population if you were incarcerated. And in the United States, something hitting close to home for us, the racial and ethnic minoritized populations, most notably Black and Latinx individuals, comprise the majority of new Hep C cases in the United States jails and prisons. The prevalence of hepatitis C is 2% in the United States, but in incarcerated individuals that engage in IV drug use, that's 35 times more at 70%. And approximately 18% of Americans who were in prison before were infected with hepatitis C versus 1.7% of the general United States population. The problem is that there are risk factors that predispose us to developing hepatitis C and B. We have older age, injection drug use, lower socioeconomic status, previous incarceration, being affiliated with a racial or ethnic minority. And what ends up happening is that developing these disease pathologies like hepatitis also increase the risk for contributing to depression, anxiety, homelessness, drug use, and incarceration. However, there is some hope on the horizon. Right now, with new medications, we can cure more than 90% of cases of hepatitis C. However, only 20% of individuals that have it know they have hepatitis C, and of those 20%, only 15% will ever get treated. However, there are some steps that we can take to improve this globally. We can have improved healthcare access, increased surveillance, better identification of those individuals that are affected, and also through using telehealth. More research does need to be done amongst the racial, ethnic, and socioeconomic disparities in order to improve health equity when it comes to taking care of chronic hepatitis B and C and by extension chronic liver disease. Thank you so much for listening, and I hope you have a great day.